Hello and welcome. You are watching Lockdown TV from unheard.com. Today is a bit of a day of firsts. First of all, we are in basically a building site that we have given a lick of paint to and done an impromptu studio. So we are doing an IRL, in real life interview instead of a down the line Skype one. So we're excited about that. It's also a first in that we have someone who we've spoken to before coming back for a second time. And that is Professor Michael Levitt, Nobel Prize winner, a professor of structural biology from the University of Stanford, who we interviewed back in May, and whose interview caused quite a sensation there. And he's been making some interesting predictions, and he's been very involved in this debate since then. So we wanted to get him back and see how that's gone. Professor Levitt, thanks for joining us.
Freddie, thank you so much. It's great to be here in person.
There's a lot we want to talk to you about. First of all, I should say thanks for doing this, and thanks for having the guts to face up to predictions you've made. I mean, there's not enough of that in this whole conversation. So the pretext and the reason we've got you here today is that roughly 4 weeks ago, you sent out this tweet, and it goes, US COVID-19 will be done in 4 weeks with a total reported death below 170,000. How will we know it's over? Like for Europe, when all-cause excess deaths are at normal levels for 1 week. Reported COVID-19 deaths may continue after the 25th of August, and reported cases will, but it will be over. How do you feel that prediction has fared?
The prediction has fared less well than I'd hoped. The number of reported deaths today, I think, is 185,000, so it's over. Excess death turns out to be delayed by 2 or 3 weeks, so we don't yet know whether it's going to be back at base level. Right now, it's about 10% above base level. It's about there's 50,000 deaths in the USA every week, approximately. So maybe 55,000. And right now, it's about 5,000 over that, so it's 10% over that, whereas at the height, it was much higher. So I think that the details of the prediction have fared less well than I'd hoped. But I think the prediction served as a milestone. Part of the reason for me being here is I made a very definite prediction. It also served to worry about what do we mean by over. So I think there are several aspects here. The importance of looking at excess death, when it's over, and the prediction. Generally, no person who knows anything about numbers would ever make a prediction. The number of pennies in that jar is 1,327,000. They would simply say it's between 1 million and 1.5 million. And if I'd said...
Should have done a range.
A range. We all know there's a range.
Yeah.
The thing is, if I'd said it was going to be between 150 and 250,000, that would have been much less of a pin. This is like a red pin in the map saying, I'm making the statement in Twitter very much so to get the reaction, to make the statement thought of.
We've actually got the data, so let's put that up. So this chart is the chart of deaths in the US with the 7-day moving average, reported deaths connected to COVID-19.
These are not the 7. Oh, the red is the 7-day moving average.
Yeah, the brown line is the 7-day moving average. You did a kind of follow-up tweet, if we can put that on the screen, which looked at this question of excess deaths. Yeah. And that we have had a bit more information on since then.
There's now 2 more days of this. Two
more weeks. Yeah, so that's the up-to-date slide there. So I guess the final blue bar there is likely to come up with
very much to where the X is, I would say.
Yeah.
And if I were to say when it really will be down to 0, it's probably going to be another 4 or 5 weeks. On the other hand, the issue of how do you define it being over. So for example, if over would be that we're never going to find the virus's RNA anywhere, my guess is not for a very, very long time. In the same way, if we really look hard, we can find the virus's RNA on surfaces in people. If it does become, like many other coronaviruses, another version of the common cold.
Just to finish on this prediction, because I think it's quite instructive to see how you got there and what happened. Is it right to say that that first curve we can see coming down you essentially presumed that that trend would continue and that this kind of second uptick is what surprised you?
Yes. The second uptick, and it should have been clear, the thing is I was very much using Europe as a model for the US. They both have very similar populations. And in the end, Europe right now has, I think, 180,000 excess deaths from corona. Or at least, no, be very clear, have 180,000 excess deaths in the period we defined as the 2020 corona season. We don't know what caused the death ever. And this is just all-cause excess death. The United States was very similar. This peak coming up, I should have seen it. I mean, I don't think, the 170 was a number I actually said at the beginning of July. And when I made the number, I wanted to sort of show consistency by not looking at the data again, but going back to that number.
Because what had happened then is that cases had dramatically increased across the Sunbelt states. And so your prediction was then based on the premise that they wouldn't lead to many deaths and hospitalizations.
For example, in Europe, there's been a massive increase in the number of cases, but the number of deaths has been, I think, less than 10,000 for hundreds of thousands of cases. So it's been a much, much lower death rate in Europe. So that was my mistake. And I'm very happy to admit that mistake. I think it's, in the big picture of things, not terribly relevant. It's not like I'm going to make money from winning the number of pennies in a jar. I think, on the other hand, it's made people think about excess death.
Do you think, in terms of method, this goes to the kind of heart of how much your sort of statistical approach can be relied on for a sort of biological phenomenon like this? Because if essentially what you're doing is you're looking at a trend and presuming that it will continue, and then what happens through this concept that biologists, stochasticity, and what happens is that surprising things happen and that it doesn't behave according to previous trends. Does that invalidate the method?
Modeling is potentially of very great value, and for certain biological systems we know enough about the forces between the atoms, the work that I really do, to actually say what's going to happen. The trouble is that we don't know enough about, firstly, there's a lot of unknowns in an epidemic that go beyond the properties of the virus. Climate, a hot season, a cold season, people's attitudes. I think this is something that I could well have noticed. Again, I wasn't really trying to make an exact prediction. I was trying to make a statement. In the middle of March, I basically looked at situations that had already reached some level of saturation. In those days, there was only the Diamond Princess and Wuhan. And based on those, you could reach a conclusion that if the rest of the world behaved like that, the excess death should be a month of natural death. At the time, the statistics were saying that the number would be 12 times bigger than that. It would be more like a year of natural death. I loved the way of, instead of saying it's going to be 55,000 people, you say it's a month of natural death. It doesn't sound as terrible, although it's not an easy thing to explain. And when I did that, which I did, and it was distributed quite widely, I think the number was about 60,000 for Great Britain, 250,000 for the United States. So, I could have said it's going to be up to 250,000. Again, I deliberately wanted to say this because I think I realized at the time that over means that curve getting down to baseline.
Before we move on from this question of predictions, why should you make them and why should we believe them if they're based on you watching a trend that then changes and we suddenly get a new second wave? If that could happen, we could get a big second wave, the real second wave, this coming winter, and all of this talk of it being over or watching curves disappear would have been for nothing because there's a great big new curve for you to look at with your
Absolutely. This whole... So what one does is one, I think, makes predictions so that when something occurs, you can compare it with something. It's very instructive. And then you can go back and say, well, look, I was wrong about this and this and this. So, for example, in this case, I can put my finger on the change rate of second waves or summer waves, which was actually in the data. If you look at Brazil is proceeding at about a quarter the rate of China. Again, because it's so, this would have been, I didn't look at it, I wasn't trying to making an accurate position is very difficult. Putting numbers into context would have changed things completely. 150,000 deaths sounds enormous. But then you look at them against the background, that is basically at 55,000 a week. This is 3 weeks of US excess deaths. This means over a year, it's about 7%, which is not negligible, but other things cause fluctuations like this. Flu is always the example. So it's very important to have a context, and prediction provides a context for future events.
Let's look at a couple more earlier predictions and see what we might have learnt from then. So the one that you always get called up on social media and your opponents like to wave around is this early Israel a prediction when you said that you would be surprised if Israel has more than 10 coronavirus deaths. You feel you were misrepresented on that. Tell us what the story is.
You know, I definitely said that. Again, I was a little bit surprised that my surprise constitutes, you know, a statement, but I'm also happy with that. The problem there was that I should have said excess death. This was on a radio program. It was early in the morning. It was a voice interview. I could well have, and it was at the very end. It was a time when in Israel there'd been no deaths and the number of cases was about 150. But I was certainly wrong about that. I think
so what have the excess deaths been in?
The excess deaths have been very interesting. So in Israel, excess deaths are depend on having a statistical estimate of what are normal deaths. Something that is very difficult to do for a small country. It's very easy to do for the entire United States or for Euromama area. But for example, if you asked what are the expected excess deaths in London, the population, which is about the same size as Israel, there aren't enough deaths to get a good background. Right. You also can't go back too many years because times change, population changes. So you can't really say, well, we're going to average over the last 100 years. I'm sure for London, we have data for 100 years and get a really good number for every week and then do that. So what one typically does is choose a previous year. And one way you can do this is saying, nobody panicked in 2017-18, right. So how do the excess deaths compare? For Europe, for example, 2017-18 was a bad flu year, and the current excess deaths in the COVID season are 37% higher or 39% higher up to date than what happened in that flu season. Now again, in the flu season, and I'm coming back to this in a second, excess deaths are not looked at. We don't know the number of real flu victims. It occurs in the winter. And during the winter, we're just looking at the peaks above the background. But the winter background is much higher. Part of that is flu. I mean, why do more people die in the winter? It's not because there's a sudden flu epidemic. It's because there's always flu. Yeah. So probably if you did that, we'd find that this COVID is no more than flu was in 2017. To get back to Israel, so there is fairly good data, and not wanting to, Israel's a country that's small, it's got a very dynamic population, went back to the last 4 years, and discovered something that was really a big surprise. So when you compare, so the year you might want to compare with is the previous year. I mean, no one felt that 2019 was a terrible year in Israel. The hospitals, not that we remember. Again, memory is very selective here. We never remember what terrible things happened during flu seasons. But when you compare 2020 to 2019, and remember the big deaths in Israel occurred 3 or 4 months ago, so things have caught up. There's actually a few hundred less excess deaths in 2020 compared to 2019. What's more interesting is they actually give data in age bands. And
so actually your 10, you would say, was overly negative, and actually you should have said minus
100. What's interesting is if you do exactly the same comparison, not to 2019, but to 2018 or 17, you find that there was quite significant excess death in Israel of about 1,000 in the rough period of Corona. If you looked at it and you try to track it against the deaths, it doesn't track. It's a much broader peak. But then you discover that 2019, if compared to 17 or 18, has exactly the same peak. So something, and it might just, my friends have said, look, 1,000, it's not a big number. There's 45,000 deaths in Israel every year. Natural death, don't get excited about this. But it still is interesting that...
So what does that make you think?
Something else happened that year. Maybe it was a different thing. And maybe that same thing has happened this year.
You mean it could have been a different virus? Or it
could have been the same virus. We don't know. I think that, again, I keep on coming back to the fact that of all the viral diseases we've ever had, only one disease has been tested as much as this. We have done millions and millions of tests for the RNA in the virus. If we would have done exactly the same thing in 2017, the number of flu deaths would be much, much higher than the current number of COVID deaths, because flu is so widespread. And remember, a virus is, it's like saying, do you die with water on you? I mean, viruses they're small things. So I think that this is a very important issue going forward. I think that in some ways we've used a test. In other words, normally diseases are looked at by symptoms. Are you coughing in a certain way? Do you have a fever? Have you lost your sense of smell? Those are all fine. But if you simply say, is the virus on you?
So this goes to the whole question of how it can ever end. Your predictions will be measured against that, but much more importantly for the world, what happens to society and where we decide to change our approach will be predicated on these kinds of numbers. Is it your view then that the virus is going to be around for a long time, maybe even forever? We will have fluctuating degrees of numbers of cases. Will those curves that we've put on the board ever go to zero?
So I think at some point we need to either make curves like that for influenza, and when people say, oh, I didn't realize influenza was so terrible and I didn't get upset about it, therefore why am I getting upset about something which is as lethal a disease but is even occurring more or less? So again, having a comparison. Panic comes from when you don't know what to expect. And in COVID, because of the method of testing, we had no idea what to expect. I think that at some point we're going to get tired of testing. It's a huge waste of money. This money could much, much better go to helping people who've lost their jobs, homeless people, on which the streets of London are very full these days. And it's great for the pharmaceutical companies selling test kits, but it's not doing anything, because you could find influenza, for example, how many people died of COVID and influenza? And why did we quite say they died from COVID, not from influenza? It's not a meaningful thing. Excess death is meaningful. And it's not just the number of excess deaths, it's the age range. If there had been 180,000 excess deaths in Europe, and they'd all been under 50, this would be a major disaster. And again, I'm not in any way trying to say that the death of an 85-year-old is different from the death of a 5-year-old. One has had their life, one wants to have their life, but there is an asymmetry here. It's in this age of PC, in the past we would have simply said, years of life lost. In this case it's 0, in this case it's 85, add them up. And medical systems do that. But nowadays, for PC, you don't say that. So it's the age range of the deaths and their number. They are comparable in number to flu, and the age range is exactly like flu. Again, in COVID, it's important to remember this and to remember it. 50% are over 85, and less than 10% are under 65. And almost all have comorbidities. I don't know about comorbidities with influenza, but the age ranges are exactly the same.
I mean, that the argument doesn't have political purchase for obvious reasons. That everyone, a lot of people are within those vulnerable groups, and even people who aren't have parents and grandparents who are. So, I don't think it's going to win the argument to say, well, they're old, so we should think about it differently.
I accept that, except that if I went to the health service in the United States or anywhere saying, look, I want a new heart. I'm important, give me a new heart. They'd say, well, look, we give new hearts to people who are young so they can use it for a long time. Equally well, the national health system has a very precise number of how much is worth investing in an old person's health. So all of this is just double speak. I mean, it's politically inappropriate, but it gets the other side of the scale about the value of an unborn child, the value of a sperm. You can make these arguments. For example, when do you turn off ventilators of people who've been ill? Terri Schiavo. These are all very, very difficult moral arguments. But ultimately, for me personally, the value, my life is much, much less valuable than the life of my grandchildren.
Considering the kind of the future, let's take the next year, there are really two big picture scenarios, aren't there? Either Michael Levitt is broadly right, regardless of the details of these predictions, and that the big peak has already happened, the roughly 1 month of death has happened, and from now on we're going to be into these kind of philosophical arguments about what constitutes a real death and whether we should be worried about case numbers if they're asymptomatic, but lots and lots of people aren't going to be dying. Or the more pessimistic view is right, which is there is even worse to come. There's going to be a big second wave. Countries that have not had it badly will now get it badly, and that the sort of proof will be in the pudding in coming months that actually the more pessimistic people were right all along. Do you see it in that two-part way?
Firstly, the future is unknowable, but it's important to realize that a virus is a very simple object. Society is a very complicated object. I worked out that the amount of information in COVID would be 40 tweets worth of information, and flu would be about a third of that. So these viruses don't have a lot inside them. They behave in very, very simple ways. And this coronaviruses have been around. One of my friends who's a virologist, I got into this at the end of January. He said, don't worry, coronaviruses, we have many of them. Common colds are coronaviruses, and they have a tendency to become less lethal. So I don't know, that could be wrong. But I think if you combine that with the upcoming news that I'm sure you're very well aware of that the herd immunity may be occurring at 20%, not at 80%, because of T-cell immunity. We basically have learned to live with coronaviruses by recognizing a cell that is making any coronavirus and killing it, rather than waiting for the virus to express itself on the surface of the cell and create antibodies. So if these things are true, and it seems that these things were questions in February, but have all become true. I just got an email saying that Manaus in Brazil was a disaster situation, reached 20% and stopped. And that's important because it's in the southern hemisphere. It's in its winter season. So if we take that as a data point, I still feel very confident, but aware that I could be wrong. I mean, I'm not the Oracle of Delphi, that this is not going to flare up in the winter. Now, again, when you talked about places that have been, pockets that have not been hit, typically the number that seems to be the magic number is about 500 deaths per million population. Again, no one wanted any deaths, but nobody did particularly well at protecting any one age group, so those 500 deaths would be half would be over 85 and so on. Seems to be a number where things saturate. And we've seen nothing. There have been centers like Bergamo and New York that got to much higher levels, and I'm sure if we were to take the population and inject them all with coronavirus, we could get to much higher levels, but immunity depends on the typical level of contact. If this had been a flu virus, I'd be much, much more worried. Flu is a much more devious virus than corona. We don't have any common colds that are flu viruses. Flus cannot be easily tamed. They're much too mutatable. Coronaviruses, by their nature, are kind of staid. They have a relatively large genome. Their genome is 3 times larger than flu. It's a single piece. Flu's genome is 7 little pieces, so it can swap pieces with other flus. I mean, it's really designed to keep us on our toes and cause massive excess deaths year after year after year. So I think that coronavirus, there will not be a winter wave of any substance. I hope it will also not occur in those countries that have been relatively spared, countries like Norway, Denmark, Austria, Israel. I think they're all actually catching up. I think there's a lot of catching up going on. Israel now is definitely trying to get as many cases as it can in order to reach some level of saturation. And the saturation number need not be 500 per million. It might be as little as 100 per million. It depends on what fraction of the population have the right T cells. That may even come from the fact that it's a country where there are lots of children. Because most people know that when your grandchildren are in nursery school, you get sick all the time if you're with them. So you're getting common colds all the time. This could be a protection for Asia, where many, many times the children are brought up by the grandparents. So these things could reduce that number from, say, 20% for herd immunity down to 10%. It's a variable number. Again, it also depends on the strength of contact. If you take a sick person and a healthy person and lock them up together in a small room for a long period of time, is a much higher chance.
It comes down to confidence, doesn't it, also? I mean, I have parents who are more elderly, and they're wondering whether they should be going out and about in London and leading a normal life, or whether they should be more cautious and staying in their apartment. I mean, what is the Michael Levitt advice to people? How frightened should people be? How much should they change their lifestyle? Or do you think kind of getting back to normal is what people should do straight away?
I think there's a price to pay from lack of normality. If we could do all these measures and it was zero price, it might be a good idea. But there's a price to pay for me not seeing my grandchildren. This afternoon, I'm going to see my mother, and I certainly hope she'll agree to see me. She's 105. It's more whether my brother will allow her to see me. He's been looking after her. But again, going back to this number, which really seems to have been confirmed, 1 month of excess risk. So every person, they don't realize this, but you have a certain chance of dying in the next month. So do I. Everyone does. People die at any age. It could be a car accident, it could be something else. A month of excess death is enough for a country to reach what seems to be a saturation point.
So on the basis of that, then, you would advocate, and if we give you the power, and Michael Levitt can now decide public policy across Europe and America, what is it? I mean, are you saying, okay, everybody, masks off, out in the street, behave normally?
What I would say is, get out and about. Do what's comfortable. If wearing a mask makes you feel better, that's fine. If washing your hands all the time but try as hard as you can to get back to normality. Lack of normality is a terrible, terrible risk. Society, we've torn the fabric of society, and all those things are torn. This is a massive risk. I don't know how to evaluate it, but I would not be surprised if the risk of tearing up society constitutes 10 times higher excess death risk than COVID. People die from poverty. People die from desperation. People die from alcoholism. I think we looked at the statistics and said, how much is alcohol use up? We could easily get a month of excess death. To give you some examples, lots of tobacco smoking, a strong smoker loses 10 years of life. It's 120 times higher risk for a permanent smoker. An alcoholic might lose 4 or 5 years of life from this compared to corona. So a month of excess death is terrible. The numbers are huge. But every single day in the world, 150,000 people die. 150,000 people die. So essentially, the world's complete toll of corona, which is about 700,000, is 5 days of normal, natural death in the world. This is a long way from 30 days. And again, I think it should be your choice. A lot of grandparents have said, look, for me, a month is actually much more important, because right now, I'm 75. My life expectancy for a typical 75-year-old who's healthy is 10 years. So for me, a month is 1% of that time. If I was 30 and I was going to lose a month, so I don't think it makes a lot of sense. I'm not sure that I would go to a huge gathering, especially, let's say we were going to have singing with lots of breathing. I'm not sure that I would travel on a very crowded underground. But these are my own personal risks. I honestly think that the level of danger, and obviously if you're a very sick 90-year-old, then you might want to be more worried. But again, it's also only a month for you. It's just that for a sick 90-year-old, you don't have too many months left. So, that's really the question. How many months do you have left? And it's also a question of how much is it worth me seeing my grandchildren or seeing my mother versus living an extra month. It's not, living an extra month doesn't seem to me to be so valuable. Now, if somebody said, well, it's this month, so be it. We don't know. I mean, I could be hit by a bus walking out of the studio today.
Let's just say that you are right in the broad brush, and that there isn't going to be huge flare-ups this winter that cause very large excess death, and that after this it's more of a sort of philosophical debate about how we deal with knowing about viruses and knowing about death statistics. How do you bring people out of their homes? What can you possibly do to change people's view of this, do you think?
So I was, again, it's wonderful having a wife that I talk to. And coming here, we were thinking about this. So on the one hand, it's probably wrong of me to say that lockdown was a mistake, even if it was, because if people have done it, they should be told that it was probably a good idea when we did it, but it's no longer necessary. There's nothing to be frightened of. And it's not, I think the whole battle with the epidemiologists who said we have to lock down the damage it's caused, that damage we will suffer. There's no point in dwelling on that. But I think going forward, we need to basically do whatever we can to get back to normal. Schools starting. I mean, schools have a massively disruptive effect, both on the children. You know, I think the fact that the museums are opening up. When I first went on Israeli television and radio in the middle of March, my main aim was to stop the panic. I think panic itself is dangerous. Panic itself, so if you did the experiment, we have two people, one who's panicked and one who's not, I'm sure the life expectancy, panic shortens your life, probably more than by a month. So we need to think about that. And again, what's important is the values of our society, to really think what we've done. I mean, you know, and the scary thing for me is that in my hardly read, but I think very prophetic media post of 22nd of March, which was a few things in the medium, I actually end up by saying, you know, what can we do to stop this voluntary suicide of Western civilization? And this is the choice that's facing us. We can decide now for zero COVID, and we can be pretty much guaranteed that Western civilization is going to, its demise will be greatly accelerated. Again, not everywhere, because I don't believe that Germany or Sweden or Switzerland, another great actor in Corona has been Switzerland. Very liberal lockdown, 2,000 reported cases, no excess death. So they got to saturation. So I think it's a question, but it's a psychological question. I think that we need psychologists, we need historians to tell us what to do.
What's interesting, a few days ago, we had a professor called Devi Sridhar on the show, and she's very much in agreement about what the end goal is. You know, I think everyone wants to get society open and life back, but she feels that actually being more militant and more activist about suppressing the virus, keeping an unbelievably close eye on case numbers, in other words, the opposite approach, is paradoxically the way to give people confidence back. You know, as you say, if wearing a mask makes you feel more confident, maybe if everyone feels that the apparatus of the state is being kind of hyperactive to try and defeat the virus, then they'll come out of their homes and come back to normal. That's the theory. How do you feel about that?
I totally disagree. I think we've had no cases. Again, we want to have two countries where one country says, we'll take the militant approach. Again, comparing Sweden to Denmark or Norway is silly. Compare Sweden to Belgium. Belgium had a pretty tight lockdown, ended up with more excess death than Sweden. So I don't think we can control this thing. There's no way of taking the virus and locking it up. This emphasis on more and more cases and contact tracing and everything like this, the bottom line is, and this is why there are two sides. One is how an epidemic is going to develop. The second is, what is the worst case scenario? And I think in many, many ways, Wuhan and Diamond Princess provided very early worst case scenarios. Now you could argue that there were actually best case scenarios, but even if we took New York, everywhere being like New York, that is still, instead of being 1 month of excess death, it's 1.5 months of excess death. It's twice. Euromama ended up being 23 days of excess death. Double that, we have 45 days. It's a month and a half. So it's not a huge, it's not a year. It's not 2 years. And I think that the problem with this is that lockdown is disproportionately damaging to the weak part of society.
You've talked about Western civilization, which is a big term. Do you actually worry that something like this could lead to the end or be seriously damaging to Western civilization? Do you think it's of that kind of magnitude?
That really worries me. I should say from the very beginning, I'm a real globalist. I have 4 citizenships, 3 active passports, and I've worked for very long periods in 3 different countries. So, you know, I have a very global view of things. I'm very non-tribal. I love watching sports games, but I don't care who makes the good move. I'm not in any way for this side or that side. People don't understand how this is possible, but it's true. You know, and civilizations go up and down. You know, we've seen this progression of science, for example, from Europe to the United States. It may move to China. This is a natural progression, as long as it's not. I mean, one good thing about science is that, you know, German results are available to all the world and so on. But there definitely is, you know, a resurgence of China. People forget that China really was a very major power, an undiscovered major power. Also true that the fraction of the world's population that was China has actually decreased. China now is, I don't know, 1.5 billion out of 8. There used to be a third of the world's population. So I worry in the sense that...
Sounds like you do think that Western civilization is on a downward...
We've seen things happen.
If it was on one of your curves, Western civilization is trending downwards.
There's a trend like this, but it's a trend which... So if we look at, you know, how do we judge countries? So China has been very innovative, actually in the financial area, using, you know, I could pick up my phone and send you £100 right now without even batting a finger. In China, a beggar has a QR code next to him. You can walk past and send him money.
What's your role going to be in all this, Professor?
I didn't expect to have any role. I got into this by accident, and I never expected it to go where it was. In some ways, the first interview with you really got me very highly boosted, and I feel, you know, Nobel Prizes are funny because you don't expect them. Unlike most other awards, you know, you're a candidate for the Oscars and you know it. If you are a candidate for the Nobel Prizes, you do not know it. So when you hear the news, it is a big surprise, and instantaneously, you've kind of undergone a massive change. You're suddenly you prize winner. It's the thing. And I think coming with that, it's maybe you're lucky. I mean, it wasn't expected. But in some ways, it's an obligation going forward. In some ways, you've become a public figure, which means you've lost some of your own privateness. And I think you have an obligation, if you can get your voice heard, to speak out. So I may end up, certainly I don't want to ever work as hard as I have in the last 8 months. I've worked much harder than any other time in my life. And this is not good. It's not good for family. It's not good for health and things like this, although I think I'm fine. Together we have 10 grandchildren in different places. We have a lot of family. But I do think I have an obligation. And I think instead of another paper on how ribosomes work or how proteins move, maybe I really need to be much more involved. An area that I have had is the one sector that got this right away. So when I started to become well known in March, basically as a result of the LA Times article, I got lots and lots of letters from financial analysts all the time, offering me money. Could I please consult them? And I basically ignored them when I felt it would be not right to do this. And then they stopped. And then I started to get papers from financial houses showing me the Gompertz curve and all of these things. They got it very quickly. And I think if you look at the markets, it's not accidental. They actually, I'm sure you would find, they completely agree with my point of view. I think they're probably discounting the damage caused by lockdown. And I was thinking that, you know, it's a tragedy these days. Excess death is really important. When somebody dies, it's pretty much certain they're dead. Why does it take 3 weeks to record that number? If the dollar drops by 1%, we know it instantaneously. I can make a stock purchase in no time. Why should all this epidemiology be so delayed? Why are causes of death so complicated? Now, I can understand it's complicated, but they should list 3 major causes of death, and we'll divide it up equally. The critical data, and I think I've said to some of the financial houses that I've been talking to, you guys need to get into the market of monitoring populations, climate monitoring. Remember, they have lots of resources. This is too important.
Well, maybe that's your new project,
maybe.
Michael.
Climate I'm scared about because it's too...
Investment fund guided by daily mortality
That's
statistics.
making money. My guess is to get investment fund managers to spend some of their money to modernize excess deaths, modernize data collection for climate, modernize, they should have their own satellites up there. Now this is too important to leave in the hands of the established. The World Health Organization has not had a great track record here on any one thing. I think their heart is in the right place, but I think that they haven't had a great track record. The established epidemiologists, by and large, have not had a great record here. Financial people, this is numbers. It's data analysis. And these people know how to do it. And it would be, the cost to the world of this pandemic has been colossal, whether it's $1,000 billion. I mean, it's massive, 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 although we don't see it yet. We haven't seen it. It would not cost very much to have in place somebody dies. And the way you would confirm this is using blockchain, because you don't want them to die twice. So as long as the death was through a blockchain-like mechanism, they would only die once. Like voting could be done very well with blockchain. So I think these are some of the areas it's going to go into. Fascinating. I'm excited. I mean, this has been more fun than I've had. Well, I know use the word fun because people are dying. But, the science has been incredibly exciting.
Michael Levitt, thank you so very much.
Thank you very much, Freddie. It's been great being here.
That was Professor Michael Levitt from the University of Stanford coming back to talk to us for a second time about his views on COVID-19. We covered a lot of ground there, from the statistics in Manaus right the way through to where the Western civilization is in decline. So lots for us to get into. Hope you enjoyed it. This was Lockdown TV.